Hi, my name is Jennifer Malone, and we're going to go over stool ova and parasites today. To start off with, helminthic infections are caused by worms. So on this slide, we can see that they're divided into two categories: platyhelminths, which are commonly known as the flatworms, and nematodes, which are essentially roundworms. Up here is a tapeworm, and down here is a fluke. Over here is a hookworm, and then a pinworm, a roundworm, and a whipworm. Taenasis is caused by ingesting tapeworm eggs or larvae. Symptoms may be absent or may be as extreme as an allergic reaction or seizure. Tapeworm can be identified using stool samples, imaging, or blood tests. Medication or surgical intervention may be advised with a positive diagnosis. In the bottom right, you can see that the tapeworm can be very long. The longest actually measured out at 108 feet. Paragonomiasis occurs when eggs or larvae from the liver fluke are ingested from raw or undercooked crustaceans. The concerning aspect of this particular fluke is that it can literally burrow into your intestines, then through your diaphragm and settle in your lungs, which can cause severe shortness of breath. Because it travels to the lungs, liver fluke can be diagnosed via bronchoscopy. Necatoriasis is particularly unsettling if you like to go barefoot. This worm can quite literally hook to the bottom of your foot and burrow its way to the inside of it. Now, being that we are in a developed country, we don't have to be too terribly concerned. It primarily occurs in countries with poor sanitation, where stool may be left on the ground. And in this picture, we can see that little worm's stuck in the bottom of that person's foot. Enterobiasis is the most common helminthic infection in the U.S. and can be identified by using clear tape and sticking it to the areas surrounding the anus. This tape adheres to any eggs laid by the female pinworm overnight. It is important to use the tape method in the morning so that the eggs aren't wiped or washed away. We will go over this more at the end of the slideshow. And this is the most beautiful image you will ever see of a pinworm, by the way. Escheriasis, or strongyloidasis, thrives in tropical climates and regions where sanitation is poor. This roundworm can cause a variety of symptoms and requires a stool sample as well. Trichuriasis has the potential to cause painful stools mixed with blood. In this photo, you can see how this roundworm looks like a whip, hence the name whipworm. Whoosh. All of these helminthic infections can be diagnosed with stool samples. Some may require more than one sample, and others, such as pinworm, may be easier to diagnose using tape. The stool sample must be as undiluted as possible to increase the possibility of eggs being found. A fecal sample should be placed into a specimen container after acquiring it. There are a variety of different methods for gathering stool. It can come from a child's diaper, a hat, or saran wrap put over the toilet. Whatever the method, try not to have it mixed with urine. There's other tests for different parasites, and some of them are listed here. Some of them you may have heard of. There's Cryptosporidium amoebiasis, beaver fever, and traveler's diarrhea. C. diff and traveler's diarrhea have different causes. Traveler's diarrhea typically occurs when one travels to a different country and drinks water that contains different bacteria, viruses, or parasites than the traveler is accustomed to. Traveler's diarrhea typically clears up on its own. C. diff, on the other hand, is highly contagious and tends to lurk around hospitals and nursing homes. patient whose gut microbiomes have been destroyed by antibiotics are especially vulnerable to acquiring C. diff, and it can be deadly. Now in the hospital, there's these signs, and they show that you must wear gown, gloves. So here we have gown and gloves, but then when you're cleaning, you must use bleach because that's the only thing that can break through the tough shells of the C. diff spores. So why is hand washing so important? We all know it's important, but why? Hand washing is important because it washes bacteria and parasites off of your hands. That way they cannot be ingested or even re-ingested, such as in cases of the pinworm. And why are patients coming from developing countries more at risk for acquiring parasites? Well, developing countries tend to have poor or limited sanitation. Oftentimes we take for granted the modern plumbing, waste system, and soap and water available to us after using the restroom. And next, I did say explain the pinworm life cycle, so we're going to explain it now. So here, you can see that there's these little blue dots, and those resemble, or are supposed to resemble, the eggs outside of the rectum. And then over here, it's a picture of a toilet and hand, because when you scratch or when you wipe or don't wash your hands, they can get stuck under your fingernails or in the grooves of your fingers or on the toilet seat. And then next, you go to eating it. I don't think anybody ever intends to eat eggs, but if you haven't washed your hands good enough, you have them stuck under your fingernails, or little kids don't wipe good and they itch it, then you can end up consuming it. So after you consume it, after about 4 to 6 hours, this little guy can hatch. And initially there's a little line going through this egg, and it resembles one half of the worm and the other half of the worm. So the little worm just slides out, and there's actually very interesting videos that you can actually watch them hatch. So once they hatch, they go down into the small intestine where they mature, and that takes about 1 to 2 months. After they mature, they come out and they drop down into the cecum, and that's where they mate. So the male then dies, he comes out with the stool, and then one night the female will come out, travel all the way to the anus and lay her eggs. And then she'll travel back, and then she'll die. But so what happens now is the eggs are back on the outside of the rectum, and you can either stop it by not bringing these eggs back to your mouth, or treat it. So it's really important that you're always washing your hands and not starting the cycle back over. Thank you for watching. The end.